So we're trying to get the energy up. I know you're tired, doctor. Let's try and get it done. In three, two, one, let's go.
All right, so let's talk about triggers for sickle cell crisis. Remember, we said there are two main kinds. There's the what's known as the hemolytic crisis, where the blood cell just ruptures and then blood count really goes down. And number two is the occlusion crisis, where the blood cells block the blood vessels, and that causes a lot of pain. So one causes a lot of fatigue and almost fainting and dizziness. The other one causes pain, sometimes really, really severe pain. So let's talk about triggers. Number one, dehydration. Obviously, that's a problem. If you don't have enough fluid in your blood vessels, the blood is not going to be moving like it should. So dehydration is one of the key things that you want to avoid, especially if you have a child with sickle cell disease, because they tend to forget all the time, and they're playing, and next thing before you know it, they've passed out. So as much as possible, you need to hydrate. If kids are going to school, pack an extra bottle, two extra bottles they can have with them, give it to their teachers, make sure that they get drinking fluids at every point in time. Two, emotional stress. One of the things that we found out when we were dealing with these kids with sickle cell disease, especially after we had been able to stabilize them, so they wouldn't, kids who were having like 2 crises a week, all of a sudden didn't have crisis for a month, 2 months, 3 months. But if these kids were in school and it was time for their exams, when it got to the exam time, all of a sudden they'll just have a crisis after having been perfectly okay for weeks and months. And so we've got to look into that and realize, obviously, was that there's a lot of emotional stress. It's the emotional stress that causes a trigger. So what we recommend now is that when it's time for the exams, they double the dose of whatever nutrients that they're taking. So in this case, we're giving them an immune support nutrient. So we told the parents, when it's time for the exams, just double whatever you're giving them. Of course, take plenty of water as well. Fever when the body temperature is hot. If you notice, all of these things that I'm going to mention and have mentioned all have to do with one word: stress. Of course, we face stress in different forms, but when the thing with children with sickle cell disease or patients with sickle cell disease is that our threshold for stress is a lot lower than the average person's stress threshold is. So you want to watch out for those things. So, and again, because we're in Nigeria, malaria is endemic, so people get fever all the time. And so it's very important to ensure that you take your medication. They take the antimalarials, the prophylactic antimalarials, and if there's any sign of malaria, fever, please take them to the doctor so they can get treated. But in addition to doing that, obviously we give them immune. I don't like to use the word boosters, but that's pretty much what it is. It helps to build up the immune system so that the immune system is strong. And like I said, in many cases, we're able to actually stop the crisis altogether because the malaria trigger, the infection trigger, is a big one in this part of the country, in this part of the world. Bleeding, cold, extremes of temperature. If it's too cold, there's a problem. If it's too hot, there's a problem. We've mentioned infections. If there's a decrease in oxygen for some reason, maybe you're in a stuffy room, for instance, you don't have enough air, you're not able to breathe well or whatever, that can be a trigger for a crisis. Of course, if she's an older lady, she's pregnant, pregnancy places a huge stress on the human body. So again, you want to double the nutrients that you're taking. I didn't say double the drugs. You leave that to the doctor. Double the nutrients that you're taking once you know that you're going to envisage a stressful period. So that could be pregnancy, it could be birth, it could be exams, it could be moving from one part of the country to another part of the country. All of these place a stress on the human body. So just be preemptive, be proactive about these things so that you don't have a crisis. What we know about crisis is that they tend to build upon themselves. So if the patient has a crisis, even though he comes out of it, damage has been done. Scar tissue has been formed, the blood vessels need to be repaired. And if they keep on having these crises, more and more damage happens. So you don't want to get it to the point, and that's why the child who has had multiple crises in the past, they've survived, the parents think everything is okay, and they just have one little crisis, and that takes the child's life. It's not just the crisis that did it, it's the cumulative effect of the crisis over the years that's caused progressive damage. So our focus with the foundation, like we've always said, is to repair and restore normal structure and normal function. We know this for a fact that many times some of the things that cause sudden death in children with crisis is not just the pain in the hands and the feet, it's actually progressive damage in the lungs, to the lung tissue, which of course lungs are responsible for taking in oxygen and for life, really. So it's that progressive damage that eventually kills the child, and that's because of the crisis. Sometimes you may not even have been feeling those crises and those pains in your chest, but because of the progressive damage. So what we want to do is to, again, we use those four approaches: address inflammation, address infection, address free radical damage, address blood flow, to try and restore these kids back to health. And the good thing about children is that they have so much more reserves, so they can recover more quickly if you support them if you support them with the right nutrients. So that's kind of like what we look at with these crises. I know that this is not enough time to really address all the different factors, but you have an idea. Make sure that your child is always hydrated, make sure they take plenty of water, make sure that their immunity is boosted, is strengthened. I think that of all the different things, that would be the most important thing I would recommend. Strengthen your child's immunity, because we live in an environment that is full of infections, full of bacteria and viruses and all those things that can just take sniper attacks at your child. So if your child is strong, it's less likely to have those infections and less likely to have the crisis. So I guess that's it. If you have any questions, let's know. Thank you very much.
Say.
Perfect.
Yes.